Hello, 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 and welcome back to another episode of Mind Your Body and Soul. We in season 3. We've made it all the way to season 3. This is episode 2 of season 3. We've come a long way from. No, actually, this is what's Matthias. This is over a year. We've been podcasting a bit over a year. Mind Your Body and Soul.
We
So,
already 1 year. We got 3 seasons. Ain't that some stuff?
because I remember our World AIDS Day podcast that we did last year. So we coming up. Yeah. So
Yeah.
we've been doing this about a year. So proud of us, happy for us, and thank you to the whole Neighborhood Medical Center team who has supported us on our way to making this happen. Because we wanted to make sure we have another vehicle to be able to reach our community and mind your body and soul is this. And with that being said, Mind Your Body and Soul is an educational podcast that focuses on all things health related to help our listeners learn more about various health topics and information they may not have access to. We seek to inform, empower, uplift, and mobilize our listeners to become the healthiest versions of themselves. And remember, you can catch Mind Your Body and Soul every Wednesday on our website at www.nmcpodcast.com, as well as our parent website at www.neighborhoodmedicalcenter.org, as well as on YouTube, our home YouTube. So subscribe to the Neighborhood Medical Center YouTube channel. Subscribe. You can also catch us on Anchor, Breaker, Radio Public, Pocket Cast, Spotify, Google Podcasts, and many other podcast platforms. So we just want to make sure we make our podcast available for as many people as possible because, like our guest today, giving vital information that can help our community become the healthiest versions of themselves. That's what we're here to do, right?
Mhm.
That's what we're here to do at Neighborhood Medical Center. So before we introduce our guest, how you doing, Matthias? I know we just came off a long weekend, homecoming weekend, fam. You know how we get down.
Yeah, you see, you got that one eye open over here.
Right,
You ain't get
right.
that much sleep, but you
Yeah,
try to fit it all in safely.
yeah.
But it's been kind of real out there, and
Yeah,
it's easy.
I do want to thank FAMU for allowing us to come up on the campus and provide HIV testing Wednesday and Friday. So we was able to, I think we did about 50 total tests between
hmm
the 2 days. So we
Which is
did a
pretty
lot.
good. Because most
So
people don't want to get nothing found out on homecoming, but
I know.
we
I
got
know that's why.
education and do what we do.
If you stick to your every 3 month schedule, you can avoid some of that stuff.
Yeah, yeah, yeah.
So so now when we're out in the community,
Mm-hmm.
people in Tallahassee, if you're out in the community in Tallahassee, you know who the community people are. You know who the people who are giving their all to the community, who are working in the community on a regular basis. And this foundation and these two people are no exception. Whenever we are in the community, we see you. You were there with us, and we appreciate it. After all the events, all the neighborhoods, they're not running from anybody. As a matter of fact, a lot of people mistake us for you guys.
Mm-hmm.
And so, so we need to get some brochures from y'all to give them out or something. But
Yeah.
we're talking about the Sickle Cell Foundation of the Big Bend, and we have Mr. Christopher Wells and Miss Carissa Hunter here representing the Sickle Cell Foundation. And so, welcome to Mind Your Body. So, welcome to our podcast. We greatly appreciate all that you do. You are definitely a vital members of our community, a vital organization with our community because you're talking about something sickle cell that definitely affects our Black community, which is a bulk of our population and the bulk of the patients that we serve on a regular basis. So I want to thank you for being here and joining us on Mind Your Body and Soul.
Thank you.
Yeah.
Thanks for having us.
No problem, no problem. So Matthias always has the first question.
I get
So
it. Easy,
so
easy.
go ahead and let's kick this conversation off. Let's
Okay.
have some.
So since we already know you guys, but we want the community to know who you are, can you give us a little background information about yourselves and why you both chose to work in helping people living with sickle cell disease?
Okay. Um, I go first. My name is Carissa Hunter, and I'm the Community Outreach Director at the foundation. A little background is I'm also a holistic health practitioner of complementary alternative medicine, and
Okay.
that's specializing in clinical herbalism as well as birth and bereavement support. Growing up living with sickle cell trait, I struggled with many of the myths we still hear today, realizing a lot of those things that I grew up hearing was not so true. And also later on realizing the lack of holistic health modalities in the community as well. My daughter, she was born in 2017 and diagnosed with sickle cell. In that same year, prior to her birth, I was working full time as a medical assistant and a phlebotomist in several clinics. And once she was born, I returned back to school and focused on alternative medicine. So they gave me a new space to dive into what I knew my daughter would need. You know, she would need me there present full time. And I just chose to help those living with sickle cell disease because it hit home. You know, living with sickle cell trait, I felt questions were unanswered. I just felt confused, or that the health issues that even sickle cell trait carriers, you know, we had to unlearn and relearn a lot of those things. And even I struggled with a lot of the physical trauma that I believed was related to my sickle cell trait, such as the pain crisis. You know, we'll get into that a little later. It wasn't until really when my daughter was born and she was tested during the newborn screening that soon after I just pushed the button further. I said, I gotta unlearn, I gotta relearn much, you know, for myself, for her, and for the community, you know, because someone has it worse, you know, or in the same position. And so I began with first advocating for myself and advocating for my daughter. And that's where I started. And I understood that self-advocacy was just like a true act of communicating our needs within the scope of those issues that we face in sickle cell community. And in order to meet those needs, I had to understand the disease. I had to understand our body, and ultimately teaching her at 4 years old, you know, how to advocate for herself. So that first step, stepping away from mainstream healthcare and getting back to studying myself, sickle cell disease, and also the alternative treatments for, you know, those living with sickle cell, because that's missing. And it's not well talked about, you know, it's not too many talking about it. And I wanted to put myself in a position that I was uncomfortable, because I knew in order to see a change, I had to be uncomfortable a little bit. And I understood that advocating for self would base on relationships that was with individuals that were already in the community that influenced the needs for us. So networking, meeting new people, that's how I met Chris, you know, because the foundation helped my family when I first moved back to Tallahassee, because this is home. And then I also noticed, you know, again, the lack of safe, natural alternatives for the sickle cell maintenance and treatment. So, you know, advocating for self, you know, encouraging others to find that power within themselves to speak up. You know, a lot of times we miss the mark on the best advocates are those that are the individuals living it.
There you go.
The parents and the caregivers, you know, and that we need to be out here studying ourselves, being able to understand the disease, knowing our body, being able to articulate our symptoms. That way we can see better diagnosis, because even I still believe I was misdiagnosed with certain things. You know, it's so many of us facing issues because a lot of people don't know how to speak up for themselves.
Exactly.
You know, so that's a little backstory of where I am with Sickle Cell Foundation. So
gotcha. Mr. Chris.
Yeah, so for me, my path to the Sickle Cell Foundation was a part of my educational journey. So I did an undergraduate degree at FAMU in the social work department, and then moved on to Florida State for my master's degree. And so part of the social work program is doing an internship. And so I did an internship at the Sickle Cell Foundation for my master's degree through Florida State. Like many people, I didn't know much at all about sickle cell disease. I just knew that in 5th grade, there was a young lady who had it. She would come to school some days and other days she would not. So that was as much as I knew until I did my master's degree internship And, one of my first assignments was to go to the hospital and meet with a client who had just got admitted. And so, I walked into the room and had this gentleman just tell me his entire life, from birth up to that day. And he just told me what his life was. And so one of the biggest things that stuck out to me on that day was we were having a conversation about his first hip replacement. He had 3 hip replacements in his life. And so he was telling me about his first hip replacement. And so when he was telling me about it, we're about the same age. When he was telling me about it, I realized that when he had his first hip replacement was about the same time I hit my first home run of my life. And so, we were the same age, near the same age, same type of, lifestyle growing up a little bit, but our journeys couldn't have been any more different. And so when I was doing the sports and doing, being physical, he wanted to be, that was his dream.
Right.
But he couldn't live that dream because of sickle cell disease. And so, like I said, my first home run was about the time he had his first hip replacement. And so that just stuck with me, that stayed with me. And I felt like I couldn't just graduate and move on and leave this population behind without trying to have some positive impact on it. And so, currently I'm an LCSW, my background is in mental health. And so I try to bring that aspect to this population, to the sickle cell population. And I sit with my clients and give them time to talk, give them time to process, and just focus on trying to be healthy, mentally first, because I feel like a lot of sickle cell complications, if you're in the right mind space, you can mentally process your some of these physical issues first, and begin the healing from that point. So
right.
That's my path. Like I said, came here through education and I've been here ever since. So
right. Now it's interesting. Your paths are different, but brought you to the same space.
Right.
And it's similar to kind of like how Matthias and I got into HIV/AIDS as well. Because sickle cell is something that we know affects our community, but we don't know a lot about. I've only had the opportunity to sit down with one young lady a couple years back. She told me her story. I had no idea, but it never left my mind. So this is one of the reasons why I want to do this interview, so more people can really understand what goes into it, what it actually is, and coming up. So as a community, we can come up with better ways to help our community members rather than just feeling sorry. Because for me, after a while, I get tired of just feeling sorry for somebody. I want to do something. So this is where we come get the education. So with that being said, help us understand, right? What is sickle cell disease? What causes sickle cell? How does it happen in the body?
Yeah, I can start off with that one, Carissa. So sickle cell disease is a genetic disorder. So the same thing that tells you what color your eyes are going to be, the same thing that tells you what color your hair is going to be, that's the same thing that tells you whether or not you're going to have sickle cell disease, sickle cell trait, or normal blood. Right. It's the body's genetic response to the malaria epidemic that happened thousands and thousands of years ago. So, we were living out amongst the elements back then, constantly getting bit by mosquitoes. Mosquitoes carry that malaria parasite, and the malaria parasite lives inside of your red blood cells. Right. So people were constantly dying from malaria back, way back thousands of years ago. And so the body said, if I don't do something, pretty soon there aren't going to be any humans left because everybody's just constantly dying from malaria. So the body decided over a extended period of time, thousands of years, they developed this trait to where some of those red blood cells were going to be in this sickle or crescent pattern, and they were going to die in 15 days. And so a normal red blood cell lasts for about 115 to 120 days in the body. But these sickle cells that the body genetically created, those cells were going to die in about 15 to 20 days. And so that was going to kill that malaria parasite, and that malaria parasite will be flushed out of the body with the dead sickle cell. And so that was a good thing. That trait in that instance was a good thing. It helped humans survive that malaria epidemic. But the problems came into play is when you've got, Jack on one side of the forest walks across and meets Jill on the other side of the forest, and Jack and Jill have a child. Both of those individuals have sickle cell trait. So there's a 25% chance with every pregnancy of having a child with the actual disease when you have a child, when two people with sickle cell trait have a child.
Okay.
And so that's kind of how sickle cell disease came to be an issue today. So people who have that genetic trait where that those sickle cells will die, and those individuals are able to survive a malaria infection a whole lot easier than somebody with normal red blood cells. And so that's, like I said, and so how it plays out today is that those two people with the trait, they'll have children. And then those two sickle cell traits, when both of those are passed down to a child, then that child can only make sickle blood. And so they've got a bunch of red blood or sickle cells that are dying every 15 to 20 days, carrying out oxygen out of the body, blocking up blood vessels, and reducing blood flow and things like that. So that's really how it plays out. And so, and one thing I do want to mention too is that most people think that sickle cell disease is a Black condition.
Right.
That it's the Black community. So the truth about that is, in our country, the highest percentage is with the African American or Black population, but behind them are people of Hispanic descent. So first in line, African Americans, behind them Hispanic descent. So it's about 1 in every 12 African Americans can have sickle cell trait. For Hispanics, it's about 1 in every 100 that have sickle cell trait. So a little bit less. And then behind people who are Black and Hispanic descent are people from Italy and Sicily. And so those people can walk through the world and present as white. You look at them, you may think, hey, that's a white person. But if they're from Italy or Sicilian descent, those individuals have sickle cell trait and sickle cell disease in their community as well. So we've got a couple of biracial families where mom is Italian or Sicilian, father is Black, and they have a child. Your mom never ever heard that they had sickle cell trait before, and they have their first kid, and this child has hemoglobin SS, the most severe form of sickle cell disease, and they're thinking, well, I'm white. How is this possible? And so that's one of the biggest misconceptions that I always like to bring to the forefront, that this has nothing to do with this specifically the Black community. It can impact everybody, anybody. There's Southeast Asian people have sickle cell disease. Just Asian folks, people of Arabian descent, Caribbean are also another population that's heavily impacted by sickle cell disease. So,
Gotcha.
Exactly. That brings up a good point, because my question is, like, what types of sickle cell disease are out there? Are there different various types, and how do they differ? Since you said that there was one that was a more common one, so can you just explain the different types and how many there are, and what's the difference between those?
Yeah, so sickle cell disease is the umbrella term. That's just kind of what we refer to as this group of hemoglobinopathies, or this group of blood disorders. But the most common that makes it most severe is the S trait, or hemoglobin S. So that's the most common. That's what most individuals have. But there's also C traits. There's also E trait, which happens a lot in people of Arabian descent. Thalassemia, beta thalassemia, alpha thalassemia, beta plus thal, beta zero thal. There's a bunch of different forms. So like I said, the most common, most severe is hemoglobin SS disease. Hemoglobin SC diseases tends to have a little bit milder symptoms. But the thing to remember, important thing to remember about sickle cell disease is that it manifests itself in everybody completely differently. So you can have somebody who has SS, the most severe form, but they've gone 30 years of their entire life and maybe had one hospitalization, if that. I know we've got clients that that have that severe form that may have been to the hospital once. We've got clients that have, say, that's hemoglobin SC disease, but they're hospitalized 2, 3, 4 times a year.
Right.
And we've also had I've met a family who the child had hemoglobin SS disease, but the mother had just the S trait, but that mother was hospitalized more than that child was. And
Sounds like me.
They're people do think that sickle cell trait, you'll even hear from some medical professionals that trait is the absence of disease, absence of illnesses, and that's not exactly accurate as well. And so the individuals with sickle cell trait can have some symptoms that look like the disease, because when you've got trait, your body makes sickle cells. It's just not as many normal red blood cells. And with those sickle cells dying every 15 days, those normal red blood cells tend to be more prominent in the bloodstream. But you can still have issues that look like disease. So professional athletes with sickle cell trait, they tend to struggle with issues that look like the disease. Scuba divers, mountain climbers, people who are constantly flying in airplanes, they can have issues that look exactly like the disease if they have the trait. So.
Okay.
I'm glad you mentioned that, Chris, because even I could attest to that. Being an athlete in high school, trait carrier, overexerting yourself in practices, it's true. Having my daughter, she's 4, she has HBSS, the most severe type, and she's never had issues to this point. She's never suffered any problems so far.
Okay.
So that was good that you mentioned that.
So what's the exact difference between the actual or what would turn the disease on or help the trait develop into the disease? Is it the mixing of the genetics?
So once if you have sickle cell trait, you're going to have that your entire life.
Right.
It'll never ever turn into the disease. Right. Okay. So kind of like if you're born with green eyes, you're not going to wake up one morning and they're going to be black or brown. And so it's genetic. So if you have sickle cell disease, you're going to have that in your entire life, unless you do something like a bone marrow transplant or a stem cell transplant. If you've got sickle cell trait, you're going to have that your entire life. That's not going to go away. And so, like I said, it's just genetic. So so everybody has 2 parts to their blood, right? If you've got what we call normal hemoglobin, then both of those are normal adult hemoglobin genes. You carry, so if you've got sickle cell trait, people with sickle cell trait have 1 normal adult hemoglobin gene and then 1 sickle gene. And so when you have a child, you're going to pass down one or the other. So if you have sickle cell trait, it's possible for you to have a child and pass down that normal blood gene. That's possible. But it's also possible for you to pass down that sickle gene. Okay. And so you can't, there's nothing you can do to determine which one you're going to pass down. It's just, mathematics, flip of the coin.
Right.
And so when you have sickle cell disease, that means both of those parts of your hemoglobin are that sickle hemoglobin. So the only thing that you can pass down is a sickle gene.
Gotcha.
So if it's SC, you might be able to pass down S, or you might be able to pass down C, but you're going to pass down some form of the trait. If you have the full-blown disease. And like I said, if you're born with trait, you're not going to wake up one morning with the disease. It doesn't work like that.
Gotcha.
And so, and then another thing that I hear is, people say, when were you diagnosed with sickle cell disease? And so I say, oh yeah, I was diagnosed at the age of 4. I was diagnosed at the age of 7. You had that when you were born. Whether the doctors did the appropriate tests. Nowadays, there's the newborn infant screening. So everybody, since 1989, I believe, everybody born in this country is screened for sickle cell trait, sickle cell disease, and about 40 other hemoglobinopathies are just issues of the blood. So, but from the moment you're born, from the moment you're conceived, if you've got sickle cell disease, you've got it then.
Okay.
And so, whether you were notified or not, whether the appropriate tests or not, whether your parents, follow through with the newborn infant screening process and get those letters or not, you have it from the moment you're born. So, whenever people say, yeah, I was diagnosed with, at the age of 7 with sickle cell disease, I was like, well, in actuality, you had it, as soon as you were conceived. So I like to kind of, put that information out there as well.
Right. Okay. So in addition to that, what determines what type of sickle cell disease you would have? How does that work?
So the different types of sickle cell disease just really tell you what part of the world your family comes from. So, if you've got S trait, those tend to be individuals from African countries, from Caribbean countries. So, E trait is, like I said, that's more popular of individuals in the Arab countries. So if you got like a hemoglobin E trait, those individuals that come from Arab countries. Alpha thalassemia is something that's found in Asian populations. So if they've got that alpha thalassemia gene or trait, that just says that that's an individual that comes from an Asian country. So like I said, wherever whatever part of the world your family comes from, is that ties in with what type of trait or disease that you have.
Gotcha. So, Carissa, having the trait, and you were saying when you were an athlete, when you would overexert yourself, you would have symptoms. So what type of things would happen when you would overexert yourself?
I would experience lower extremity pains in my legs, swelling and stiffness. That would it's like a cramping, dull feeling, and it'll last for hours, not minutes. And even I've heard stories with me being at as young as the age of 4. My mother, she didn't know what was going on. Doctors at that time would just brush her off and say it was rheumatic fever, or it was growing pains. That's the most common thing that we would hear. It was growing pains. And later on, as I grew older and got to high school, I remember when I didn't hydrate myself, I literally passed out at practice. And that was from me being dehydrated. And emotional stress would trigger my body to respond and become tense. So that'll create a domino effect of like tense and then spasms, and then it'll affect my legs. And even today, I still have a better understanding of it. So, I limit, I know how I could respond to outside triggers to that. So those are the most common things that I've experienced as a trait carrier, was the lower extremity pains that I even still deal with from time to time if I'm not careful, with how I deal with environmental stimuli, my mental health wellness, how my emotional, my mental, all of that ties in together with how my body responds to that. And it's just like what Chris mentioned, it's like individual based, everyone responds totally different. I tell people all the time, you can have two children with the same type of sickle cell, and they both have two different experiences. And I've seen that with my own. I've seen children the same age as my daughter with the same type, and they are on medications, crisis every month. My daughter has never experienced that, but it's the lifestyle differences. It's how they're nourished in home, out home, how they eat, how their mental and emotional is well taken care of. All of that ties in together.
Okay.
Yeah.
So how old were you when you learned you had the trait?
My mom made sure that we were aware the moment it stuck in our brain, probably as young as 8. She didn't know much. She just said, always make sure when you go to the doctor, you tell them you have sickle cell trait. And I'm glad she did. I didn't know much, but at least I appreciate her, pounded that in my head. Like, you have sickle cell trait. Make sure they know that. Make sure they know that. And it just carried on throughout my whole life.
Gotcha. Yeah. Okay. All right. Thank you for that.
Yeah, appreciate it.
One thing I want to chime in here and mention, Carissa mentioned the emotional stress. And so for sickle cell disease is as much as an emotional, condition as it is a physical condition. And so something as simple as an argument or disagreement or stress about how you're going to pay a bill, these are, things that can trigger a hospitalization. So, if you think about, an argument or a fight that you've had, your heart rate goes up, your adrenaline is flowing, your heart is starting to, push more blood around your body. And if you've got sickle cell disease, then that means your body's, your heart is pumping more sickle cells around. They're pushing those sickle cells around much faster. And so it's that much easier for those sickle cells to stick together, block blood vessels, and if it's blocking blood vessels to and from the heart, to and from your brain, to and from your extremities. All these are issues that can lead to a hospitalization and or death. So
Right.
Something as simple as an argument or a disagreement, or stress about if I get sick again, then that means I can't go to work next week. And if I can't go to work next week, then I can't pay my utility bill. And if I can't pay my utility bill, then the lights are going to be off. And something as simple as, here I go, I woke up feeling a little stiff, or a little, feeling like a crisis is coming. All of that can trigger this, this landsliding impact, to where, an argument can literally lead to death in an individual with sickle cell disease, or a disagreement, or you swiping your debit card at Publix, and then and it getting declined. That can literally lead to an individual with sickle cell's death if they're stressed about something, and it triggers a crisis. And so that is, like I said, I always tell people that sickle cell disease is as much emotional as it is physical. So
and
like I said,
I'm sorry.
Yeah, no, go ahead.
I didn't mean to cut you off, but while I thought about it, I remember mentioning this, that we were talking about mindfulness, and I mentioned how much stress is a risk factor for a lot of chronic illnesses.
Yes.
And even if you think about how stress actually degrades the tips of our chromosomes, the telomeres, and those are the complete subunits of our DNA. It will, every time a cell divides, a little bit of that breaks. And when the cell divides a number of times, that's it. Stress actually speeds that up, and it speeds up the breaking off of those telomeres. So learning how to deal with something like stress, living with sickle cell trait, actually lengthens those telomeres on our chromosome. And I've said this before, people say that experience or that journey took so many years off my life. It literally probably did.
Right.
Yeah, it literally did. Yeah.
Right.
So that was very good point.
Yeah, now I do appreciate that, because I know we talk about it here on our end when we talking about STD prevention and HIV. Especially, I remember a situation, a young girl with herpes, and one of the things that could cause outbreaks is stress. And so distress is not good for the body. Eustress is different, but distress is not good for the body. So my next question, because you guys having all my questions pop up in my head. So, because both of you have said people experience a crisis. Now, I know what a crisis is, but for those who may not know, could you explain what a crisis is and how it affects the body?
Yeah, so a sickle cell crisis is the term for the complications that an individual has with sickle cell disease. So a sickle cell crisis can be a number of things. A sickle cell crisis can mean the beginning of acute chest syndrome, which is sickle cells being blocking blood vessels in the lungs. Sickle cell crisis can be pneumonia. It can be an early sign of a stroke on the horizon, especially in young children. Which is another sad fact about sickle cell disease, is that the children tend to have strokes, a lot more than the older individuals. So once you get to about 15, 16 years old, your risk for stroke kind of declines a bit. But yeah, so a sickle cell crisis is any complication that an individual with sickle cell disease has. So it can be the pain in the long bones, and so or the pain in the lower back. But a sickle cell crisis is just the term that encompasses all of those complications that individuals with sickle cell disease have. And so a crisis looks different in everyone, and a crisis is treated different in everyone, which is another fact that people don't necessarily understand, is that if you got two sickle cell patients presenting to the emergency room on the same day, one individual may take some respond to hydration therapy, IV fluids, and the other person may need IV fluids plus pain medication. Or the other person may be hydrated well, but they just need that pain medication to reduce the pain. So a sickle cell crisis is any number of complications that an individual with sickle cell disease has. And so, and then anything can trigger a crisis, like I said. So something as simple as, you bumping into somebody. And so this is something that, we see a lot in the children that we deal with. Something as simple as just bumping into somebody in the, excuse me. Something as simple as bumping into a classmate in the hallway of school can trigger, a sickle cell crisis.
Right.
And so it's something that we see a lot with children in school. And so sports is another thing. A lot of the hematologists, the pediatric hematologists, they don't necessarily eliminate kids from sports. They'll let them, they'll monitor, they'll figure out what they can do, and they'll let them try. They'll let them get out there and they'll let them, attempt to play in. But once they figure out what their body's limits are, then that's usually when they start to restrict things. But
gotcha.
So any complication, eye issues, you can have eyesight issues as with individuals with sickle cell trait and disease. So anything that encompasses the complications of the sickle cell patient.
Gotcha. Okay. Because and I'm glad you cleared that up, because in my mind, and I formed this in my mind based off the way it was explained to me by a young lady who was telling me about her experience with sickle cell. And she had severe experiences. So in my mind, I thought a crisis was always, something so totally severe. But you're saying there's a range.
Yeah, absolutely. There's a continuum. We've got some clients. They're so in tune with their body. They're able to. They do a great job of managing a crisis at home.
Right.
We've got some client, and that's that comes with communication with their primary care physician, communication with their hematologist, and then just really paying attention and listening to their body. I've got a client that if she wakes up at 9 o'clock in the morning, she can take an inventory of her body. She'll sit there and mentally take an inventory of her body. She will know that she knows that if I wake up feeling this specific way, that if by 1 p.m. or 1:30, 2 o'clock, if I don't have fluids or pain medication, then she's going into a full-blown crisis and she's down for 2 weeks. Right. Or she knows she can wake up and she's feeling a sort way, and so she knows that, hey, I need to eat, I need to drink lots of water, and then I need to take a nap and I need to rest. And she can treat herself like that. And so she knows the difference. By the time she wakes up, within an hour of waking up, she knows the difference of, this is something I can manage at the house. This is something I manage at home. Or this is something that's going to be a little bit more severe, and I've got to get, I need to get some help, and I need to get it, soon, or this is going to be something that's going to, take. And so, there's a lot of anxiety in that, and dealing with that, which exactly. is another issue that I notice a lot with sickle cell patients, is that anxiety that I know here it is, it's 9 o'clock in the morning. I know that if I don't get hydrated, if I don't get, an IV hydration, then I'm going into a full-blown crisis. And so that now they're thinking, well, I wonder who's at the emergency room. I wonder how busy they are. I wonder if they're going to believe me. I wonder if they're going to trust me. I wonder if they're going to want to, and so that anxiety, some of that, and a lot of times that'll keep a patient home.
It will. Before
they can go get help.
Right.
Unfortunately, and this is terrible, but we just had this issue happen on Friday, where a client woke up and for 3 days he wasn't feeling well, but he did not want to go to the emergency room because the last time he was there, he got thrown out. And so unfortunately, this particular individual lost his battle with sickle cell disease over the weekend because he didn't get to an emergency room in time. And so it's an honest fact that a lot of these clients, because of this thought process of drug seeking, because they know their bodies, that if I don't get this, then I'm going into a full-blown crisis, and I'm going to be down for 2 weeks where I might lose my life. And so sometimes they come into to the hospital, as a professional patient. If you think about somebody who they've lived with sickle cell disease, they're 27 years old. For 27 years, they've been dealing with sickle cell disease morning, noon, and night, every single day of their life. So they know what it feels like. They know that, I overdid it yesterday. I had a bunch of assignments. I had that stressful final exam. And they know that they stayed up too late studying. They had a bunch of stress. They were worried about it. And so they know that, this next week probably isn't going to be good for me. And so they do their best to try to hydrate. And they try to get well, but if they can't keep up with it, then they go to that emergency room. They know that something, they know that, hey, this is what's going on in my personal life, and I just need some hydration. I just need some pain medication. And then if you walk into an emergency room and you're telling an emergency physician that's been working for 30 years in an emergency room that, hey, I need this and I need that, that sets off red flags in their head. Those alarm bells go off. They say, oh, this person is coming, looking at this, or they're just trying to, they're coming in to get this drug or something like that. And so that's another battle. There are regulations that bound these medical professionals, that they've got the DEA watching them, and they can't prescribe this.
Right.
So there's, it's tough on both ends. They've got to be careful, because unfortunately people do take advantage of the system. But like I said, if you got somebody who's 34 years old, they've been dealing with sickle cell disease for 34 years. They've been listening to their body for 34 years. So they, a lot of these patients know themselves inside and out, and they know that here it is, 9 o'clock. If I don't get hydrated by noon, this isn't going to end.
Right.
So.
Okay.
And I want to add something, if that's okay, because I love what Chris said. Basically, it's awareness of self. And a lot of times you have us that are aware of ourselves, but there's also this power imbalance within the healthcare system, which I had already saw in general working in some clinical spaces. And that's what broke me. For me, I couldn't be a part of that brokenness where patients were unseen and unheard. And where the power lies is with the physicians and the healthcare providers, right? Even so, in the realm of those patient-centered care, where the individual is the key member of the care team, most times just blindly, their families don't have an equal voice, or themselves have an equal voice in the decision-making process. And so that minimizes individual patient engagement, in that whole process. So it's difficult. It can be difficult because, like Chris said, when you do know yourself and you know your body and you're firm with that, a lot of times they'll end up get referred to as difficult or non-compliant, especially with respect to pain management. It's to have an activated individual who knows themselves and just engage with their treatment or their health and wellness, invested in their chronic care process, it gets overlooked. It's almost as if there's this whole look at, like, you can't know, your patients can't know themselves. It's like an intimidation tactic sometimes where, even as a parent, I've faced it, where I stood my ground and I said, no, I know my daughter, and we're going to work as a team, instead of you telling me let's talk about what we can learn together and what I feel comfortable with, instead of threatening me with death, because that's one of the things that, you hear often. Well, at this age, you're going to die, and, you're going to face these issues. Even that alone, those words will implant in someone's mind and create a spiral of different thoughts. So that can communicate with a person's neurological, system, and everything else in the body, how it responds.
Right.
So it's so important for us to really talk about that and really, really hammer down on that, because it's difficult out here.
Yes, it is. But we talk about something here. We've created a whole presentation. We've created a podcast around it by making sure people make the best of their healthcare visits. But like you said, we do create the client-centered scenarios with our patients, but you all, like I know, there's a certain way to advocate for yourself, certain language, certain things that you need to say when you get in these certain spaces to get you past the red tape. So with that being said, for both of you, what tips or what advice would you give someone when they're going into the medical setting and they need to advocate for themselves in the realm of sickle cell, but they may not know what to say? What kind of tips or what things would you tell people to make sure they're articulating or make sure they're having the doctors look at to make sure that the issue is taken care of and they're not just sent home with nothing happening?
Yeah. So one of the more powerful tools that I believe in is a go bag. And so what that is, it's a bag it's a bag that a patient or a client can keep by their door or in their vehicle. But in this bag is everything they'll need for a potential hospitalization. So you've got your toiletries and things like that, maybe a change of clothes. But what's also in that bag is communication from your primary care physician and your hematologist. Okay. So your hematologist's name, their phone number, maybe some orders, medical orders that they things that they use to treat a person or treat that particular individual with sickle cell disease. And so those are powerful tools. And so, like I mentioned earlier, with the presentation of a sickle cell crisis to a client, that brings anxiety and stress. And so, for a lot of patients and a lot of clients, when they wake up in the morning, they feel that crisis. Mm-hmm. Their sense of reality leaves, and they go to that accelerated, anxious point. And so they're thinking about, what if this is the last time? What if this is it for me? Right. And so it's hard to focus and it's hard to communicate with people when you're in that mind space, when you're thinking that, if you don't do something, if you don't help me, then I'm going to die. That clouds their thought process, that clouds their communication, and all of that. So right. if they have their hematologist's information, if they have a letter from their hematologist that states that this client typically gets this many milligrams of this medication during this time period, then that helps bridge the gap for these emergency room physicians that are doing their best to triage these very sick individuals in an emergency room. And so that letter or that communication, written communication on the letterhead from their hematologist, can do a lot to smooth that process over. When that patient is filled with so much fear and anxiety, maybe they've got a loved one with them that's filled with that same thing, and I personally, I don't have any children. My wife and I don't have any children, but I could not imagine what it would be for a parent to have a child in that much, pain and that much danger. It's got to be really difficult to communicate. It's got to be difficult. For me, even just seeing my young patients, my young clients, that gets me. That to see a young child in a sickle cell crisis, it is very, very difficult. Yes. And so I could not imagine what it would be to be a parent to have that. And so, like I said, that communication, those pleasantries, all that stuff kind of go out of the window when you're thinking about your child not making it or you not making it. So having these letters prepared from your hematologist ahead of time that are in that go bag. So when you're filling it, you grab that bag, you hop in the car, you're hopping in the ambulance, and you get there, and then you give that information to the emergency room physician. They can start making those calls and those connections, figuring out how to treat this patient. That's one, like I said, for me, in my opinion, that's one of the most valuable tools that I can give a client, is help them to prepare and set up their go bag with that information, that communication from their hematologist. So,
gotcha. Okay. Now thank you for that. Thank you.
That was really good.
Yes, and because I do not like to see clients, patients, or anybody in the position where they need help, and they're in the space to get help, but there's a communication barrier, and those who and the people, this person needs help, and that it's your job to go above and beyond to understand them, to be able to help them, but they don't, because there's a barrier that people like to allow to stop them. So if I have something that can push that down, like, hey, this is my information from my primary care physician. This is my information from my hematologist. This is what I have a history of. So now it gives me more legs to stand on rather than them just trying to figure out. Because like you said, you was saying, Carissa, they was telling you it was growing pains.
Mm-hmm.
And you like, no, this hurts. This is not no growing pain. This really hurts. So, but I do think getting this information out, letting more people know that you have a right to advocate for yourself will really help a lot of people get past those humps.
Right.
Absolutely.
Yeah, and that one final thing I want to mention, that there are some great physicians, there are some great doctors that do an excellent job of taking care of sickle cell patients. One sad fact about Tallahassee is that there are no pediatric hematologists in this city.
Wow.
There are no sickle cell doctors for children in Tallahassee. The closest pediatric programs for sickle cell patients are in Jacksonville, Florida, or Gainesville, Florida. And so, that's another, barrier that creates a lot of issues and stress for parents, is that, if my child does go into a crisis, the only thing I can do is get them to a local emergency room until they can be life flighted to Gainesville or Jacksonville, put on an ambulance. And so that's another thing that, like I said, adds that barrier of stress, and preparing ahead of time, preparing when people feel good will help them in those times where people are feeling bad. But an emergency room physician, I think a part of their role is to slow things down, to slow the process down, so they can get a look at the full picture. But that can be, that kind of goes, that's counterintuitive to a person with sickle cells thinking they want things fast.
Fast,
I bet.
So and like I said, that information, being communication from their hematologist works great. But there are some great doctors out there that understand the path of sickle cell patients and want to do their best to help. So.
And that's what the foundation's for.
Yes.
People like me and Chris, and helping those use their voice when they're afraid to, because there are some that are afraid to. At one point, I was afraid to ask questions. I felt like I couldn't ask the doctors questions, but until I had to get in my mind that I could read the same books they can. I can go to that library and study what they're doing. There's no way, I'm going to allow them to know more about me than me.
But what
So
you just said is powerful.
Yes, seriously. Don't be afraid to ask questions. I teach my children to ask questions because it opens up a deeper dialogue. Get in depth. Just ask questions away. There's nothing wrong with that. Just ask them. And I hope that encourages, at least a few to take on change openly when it comes to their health and wellness, because I believe in order to help maintain wellness, especially in the sickle cell community, one has to understand the pathologies that approach a person's dis-ease of the mind, body, and spirit.
Yes.
Because like what Chris said, we're working with genetics. And our connection to nature and to earth and our environment, our relationships with everybody, and really our relationship with ourselves. So that's important.
There you go. So I do want to ask this question: how is sickle cell detected in the body?
You said, how is it detected?
Yes.
So so we, for instance, we do a rapid test where we can take a lancet, poke the tip of your finger, draw a little bit of the blood and drop it in this a solution that'll tell us whether or not there's a presence of sickle cells. And that's usually just a rapid test. It doesn't single out disease or trait. It doesn't tell you what type of trait you have. It just detects the presence of hemoglobin S cells in the blood. I tell everybody that we'll sit down and wherever we do those tests at health fairs and things like that, I tell everybody that I come in contact with, this is not a lab setting. This is not, we're out here in the elements doing this. To 100% rule anything out and to confirm anything, you need to have what's called a hemoglobin electrophoresis test. And so that's a blood draw. They run it through a lab, and that will tell you every single trait known to man and whether or not you have it. And so that screens for everything. And then that's something that you can, and whenever you're doing blood work, you can ask your primary care physician or somebody to order it. And that, but that's, if I tell people, if you're going to have a family one day, if you're going to, if that's a choice that you're going to make, then have that test done. It's easy to know what you're getting into. There's a lot of advancement with medicine. There's a lot of doctors are learning more about sickle cell disease. Patients are learning more about sickle cell disease. So, the life expectancy now is about 50, 55 years of age, but we've got clients that are in their 60s and 70s and one approaching 80 here in our community in Gadsden County. And these are individuals, like I said, they know their body, they're self-aware, they exercise, they drink water, and walk every single day. And so, like I said, it's not unheard of for sickle cell patients to get 70, 80, 90 years old nowadays. But a hemoglobin electrophoresis test is a blood draw in a lab setting, and it'll tell you whether or not you have whatever trait you have, and what type of disease you have, what makes up your sickle cell disease and all of that.
Okay. So hemoglobin electrophoresis test.
Yep, it's a long name, hemoglobin electrophoresis.
Good job, though. That's a good.
It reminds me, like I say, because it's kind of parallel to what we do in HIV, because we also do HIV rapid tests that could, hey, there may be an antibody present, but you have to come in and get the nucleic acid amplification test, right? And as our 4th or 5th generation to really tell where you are. And so I can see the crossover. I can see the similarities in it. Okay.
So, question: how long does that test take? The rapid? You get it back instantly in 15 minutes?
The rapid test?
Yeah.
For ours or
for yours?
Yeah. So that is about 5 to 6 minutes actually on the spot to tell you. Yeah, it's an interesting process. But yeah, it is. We drop it in this specialized chemical sciencey solution that I don't know much about because I'm a social worker and a clinical social worker. But it will tell us whether or not there's a presence of S trait cells in 6 minutes, 6 minutes or less. So
that's not bad.
It's quick. Like I said, just a poke of the finger, and it'll tell you whether or not if it comes back positive. Like I said, my thing is always go have your doctor do some more tests and confirm, deny, or whatever.
Gotcha. So how does the Sickle Cell Foundation, what are some of the initiatives and things that you have at the Sickle Cell Foundation to get out in the community to help educate people about sickle cell and actually make sure they're taking their health more serious and looking at that?
Yeah, so a lot of, so our program is twofold. There's 2 parts to our program. One is the direct services to the individuals and families that live with sickle cell disease and sickle cell trait. So that's financial assistance, that's travel assistance. And like I mentioned, there are no local pediatric hematologists. So a lot of these families are constantly driving to Jacksonville and back or to Gainesville and back for these checkups and follow-up appointments. So we step in and we help out with that. We provide gas cards. If let's just say if a parent had to miss work because their child was hospitalized, we can step in and help out with a utility bill. We can step out and help out with rent or housing, things like that. I tell our clients that our job is to help. So anything that you need, anything at all, if it's anything, you come to us and you let us know. Our job is to either do it in our office or find somebody in the community to do it. So that's the direct services. And then there's the outreach portion where we're doing workshops, we're doing presentations, we're doing screenings, we're attending other people's events, and we're doing anything and everything we can to get the word out. And Carissa does an excellent job on our social media side, making sure that all of our social media initiatives are up to date and out there in the community. She's a very talented social media presence, all the way down to digital design and things like that. So she's helping us get the word out on that end as well. So,
okay, no, I appreciate that because, like I say, when we're out in the community and we're in the trenches, you are always there. You're always there, and it's not something that just started. We're talking years. I've been in HIV/AIDS prevention for about 12 years. And I don't know exactly when you started, but I feel like I've been seeing you the whole time.
Yeah, it's been about 11 to 12
Yes.
years that I've that I've been at it here. So
Right.
yeah.
Right.
Yeah,
And so,
I remember early running into it.
that's the great things about this is using this platform to let the community know about people like yourselves who are really out here fighting for our people, fighting for our community, and making sure that people have the resources they need to improve themselves, to help themselves. Tallahassee has done a great job of being resourceful. If people want food, they can find food. If people want medical care, they can find medical care. If people want this. It's a lot of things that are free and accessible in Tallahassee, and you guys have made yourselves a part of that group of people whose resources are free and accessible and all these different things. And people can find you, and you come to the people as well. So my hat's off to you and everything you guys have been doing. We definitely appreciate how you've served the Tallahassee community.
Thank you.
Thank you. Appreciate it.
So before we close this down, and start with you, Carissa, can you give our listeners some contact information? Hey, CNBC, Oprah, somebody may see this and they say, I want to interview them. How do people get in contact with you?
You guys can get in contact with us. We are on social media, Instagram and Facebook. Instagram is Sickle Cell Leon. And then on Facebook, it's Sickle Cell Foundation. And also we are in office. We are there Monday through Thursday. Correct me if I'm wrong, Chris. 850-222-2355 is our office number. We do take walk-in sickle cell trait testing. Also, we're always constantly, now our online presence is growing. So we're keeping it up to date now, where when we're on events or doing events, we share that so that the community knows where we are every week, where they can meet us at to come and see us. Also volunteering as well. With me being over the community health fairs, we're building our volunteer team. That way we can have these advocates, have us involved, those involved, to go out and send these teams out to cover these events and get the awareness out, get the people tested, because it's so important. So yeah, if I missed anything, Chris.
Yeah, no, that covers it. Like Carissa said, you can walk into our office and get screened absolutely free of charge. The only thing I need from you is a drop of blood from your finger. That's it. And so, it just anytime we're off of Northman Road, just past I-10, going towards Lake Jackson. But our website, sicklecellfoundation.org. You can find all the information there. Like I said, if you just want to walk in, you got some questions about sickle cell trait, Monday through Thursday, somebody is here. And I wouldn't mind sitting down, having a conversation with you about trait, getting you screened, and anything that you need help with. That's what our job is. That's what we're paid for. So
cool. I mean, excellent. You two do an excellent job. You gave excellent information. People definitely learn a lot with this. I just appreciate people who have the passion and they're real about helping people, not just here for the photo ops and things. And so because that really helps our community progress rather than just look like we progressing. So
right.
Definitely.
It doesn't feel like a job.
And that's the best thing.
Right.
That's
it
the best
feel
thing.
like a job.
Right.
And we're hoping to shift, me and Chris, I'm so thankful. And I tell them, I'm so thankful that I can go from parenting to truly in this work, take my gifts and share it with others. And we're hoping we shift and bring in a lot of things when it comes to more holistic health, mental health awareness, because that's a huge thing. And also those in the LGBTQIA community that have sickle cell, because often already they are battling a lot of the racial justice mistreatment, the public health mistreatment already enough. And I know that they're out there also, some with sickle cell, and they need to feel like they have a safe zone to come to and get help with us. So they are safe with us.
Exactly. That's
right.
good. That's good. See, this is why we do this. This is why we do this. And this is why I always tell people, get out in the community and meet people. You go somewhere, you don't have to have you don't need no line. Just say, hey, my name is, and put your hand
Yep.
out. And then that's why you get connections like this, because you guys, somebody's going to see this, and this is going to really help somebody, because it's going to give them information they may or may not have had. So we appreciate that. Mind your body and soul, no problem. This is Mind Your Body and Soul. He's Matthias Sweet, I'm Joseph Ward. And remember, we're an educational podcast that focuses on all things health related to help our listeners learn more about the various health topics and information they may or may not have access to. We seek to inform, empower, uplift, and mobilize our listeners to become the healthiest versions of themselves. Remember, every Wednesday, www.nmcpodcast.com, neighborhoodmedicalcenter.org. Subscribe to this YouTube channel, Neighborhood Medical Center. Subscribe. We're on Instagram and Facebook as well, Neighborhood Medical Center. You can also listen to us on Anchor, Breaker, Radio Public, Pocket Cast, Spotify, Google Podcasts, and all your favorite podcast platforms out there. So he's Mr. Christopher Wells, Miss Carissa Hunter, Sickle Cell Foundation. He's Matthias. I'm Joseph. We are out of here. Y'all make sure y'all be healthy and be safe. Peace out.